my name is Aaron Montgomery, and for today's video I'll be talking about anxiety reduction techniques. To kick things off, we'll be talking about somatic anxiety. Symptoms of this include muscle tension, increased heart rate, rapidly breathing or hyperventilation, excessive sweating, or even nausea. So the first technique is probably the easiest and simplest way of controlling anxiety, and that is breath control, where you simply just take slow, complete breaths. And how you do this is, imagine that your lungs are divided into three sections. So you got your lower, your middle, and your upper. And so you want to start off with the lower by breathing in and expanding your diaphragm. Next, you want to fill your middle area by expanding out your rib cage. And third, you want to push your shoulders up and back to fill the top. Hold it for a couple of seconds and then slowly breathe out. Doing this triggers your relaxation response and will lower your anxiety. And as you can see, it is very quick and easy to do. So athletes prefer doing it in, say, timeout situations, or between sets for tennis players, or just for golfers when they want to take a long putt. Next will be the progressive relaxation technique, which is a two-stage process of tensing and releasing muscle groups. So if your right arm is feeling tense during, say, a basketball match and you're about to take some free throws, you will tense up your whole, make a fist, tense up your whole arm. You can choose to make a muscle if you want. I can't really. Squeeze for about 5 seconds and then let it go. And this will relax your arm out and be more in control for when you take your free throws. If you feel tense in your shoulders and neck, you can simply push your shoulders towards your ears, hold it for about 5 seconds, and then let it go. And this will relieve some of the tension that's hanging out in your neck. So that is our somatic anxiety. Now moving on to cognitive anxiety. And it is a little more challenging to know if an athlete does have cognitive anxiety because it's all internal. We can't actually see it. The only way we find out about it is by getting an athlete to fill out questionnaires or surveys. So some symptoms of cognitive anxiety include fear, choking, repetitive negative thoughts, depersonalization, and difficulty concentrating. So techniques for reducing cognitive anxiety, and the first one is the relaxation response. It's basically just meditation but without the spiritual or religious elements attached to it. To do this, you want to first off have a quiet place. So you don't want any distractions around you. Turn your laptop off, put your phone away, and just sit somewhere quietly. The second is getting into a comfortable position. So you want to get in a comfy chair or on a nice yoga mat with your legs crossed. You just want somewhere that you can hold for the whole session. Don't do this in bed because you'll more than likely fall asleep and you have to be conscious for this. Third is having a mental device. A mental device is just something in your brain that you're just going to repeat over and over again internally. So it can either be a sound or a phrase, a word. So you could repeat the word calm, calm, calm over and over again. Or if you want to go for the cliche of you can probably do that as well. And the last one is just having a passive attitude towards it all. So just being pretty chill about it, and if the thought does come into your mind, paying it no attention and just letting it wander off. But if your mind does tend to go down that path and wander off a bit, don't stress out and just bring yourself back in by going back to your mental device and refocusing. This technique, it does take some time to learn and become competent in. So when you first start out, you want to do a minimum of 20 minutes a day just to start with your training because it is going to be difficult. Studies have also shown it's not advisable to do the night before a big competition. So just say you're going into a grand final for the NRL or something, you wouldn't do this the night before. You do it probably minimum 3 days prior. Optimal will be a week beforehand. Next up, and the final technique, is systematic desensitization. So over time, we're disconnecting the feeling of anxiety from the anxiety-inducing stimulus. So this process can take months to achieve and to complete. So we would never ever do this in the regular season. We would always do it in the off-season of competition because it does take that long to do. And it can be detrimental to the season. So we start off by creating an anxiety hierarchy where we start off with the least anxiety-inducing stimulus all the way up until the most very anxiety-inducing stimulus. There's usually 8 or 10 phases. So for example, we'll take DeAndre Jordan, who plays for the Los Angeles Clippers in the NBA. He's a pretty terrible free throw shooter. His technique is good, it's just every time he gets to the line, he just chokes. So how we would treat him is we would sit him down, create his hierarchy, which the first least inducing would be him just casually thinking about basketball in general. And the most anxiety inducing for him would be, say, a Game 7 championship match, 5 seconds to go, he gets fouled, he's got to go to the free throw line, and he's 1 point behind, and he can either tie or win the championship. So we have him think about each phase, and when that phase no longer produces the anxiety, we move on to the next phase, and we slowly work our way up until we get to the final one and it no longer elicits anxiety. So that's our anxiety reduction techniques. I've been Aaron Montgomery. If you liked the video, like it or comment on it, and that's all. Thank you. Bye. Include the relaxation response, which is, there's a cat.